5 Common Types of Dental Surgery by Ultimate Dental, posted March 8, 2019 in Dental Services. Patient education. Many times, when a dentist mentions dental surgery, it is met with widespread panic and fear from their patients. The idea is that dental surgery is a painful and expensive procedure. However, what many patients don't realize is that dental surgery is very common and includes procedures that address conditions that many people have and suffer from. Each patient is different, and every case is treated accordingly. For the most part, dental surgery is considered an outpatient procedure, and patients can generally resume normal activity within a few days. Before deciding whether or not you are a candidate for dental surgery, dentists refer their patients to an oral surgeon. This is who will assess the situation and your oral health to determine the best course of action. In some cases, and depending on the severity of your condition, oral surgeons are able to recommend non-surgical treatments. Adults and children are both at risk for oral health issues, although not all surgeries result from oral health conditions. The most common types of dental surgery are procedures that many people may not consider dental surgery because they are so routine, such as orthodontic work or teeth whitening. Common types of dental surgery. 1. Root canal. Root canals are widely regarded as the most common type of dental surgery. Millions of teeth are treated each year, saving many teeth from extractions and relieved from pain and sensitivity. Root canals are typically pain-free and incredibly effective in treating pain. Underneath the tooth's enamel is a soft core called dental pulp, which contains blood vessels, nerve endings, and tissue. When a tooth is decayed, bacteria enters the tooth and damages the pulp. The infected pulp causes dental pain, occasional swelling, and causes potential pain in your neck or jaw. A surgeon can treat this by removing the decayed portion of the tooth and extracting the infected pulp. 2. Dental implants. Dental implants have changed the way dentistry has evolved over the last 25 years. An implant is a replacement for the root or roots of a tooth. They are used to secure crowns to the jawbone using titanium and titanium alloy. These metals are used because they are lightweight and biocompatible, which means they aren't rejected by the body. Dental implants are used to replace teeth due to decay, disease, oral cancer, or a number of causes like smoking or alcoholism. Dental implants are a longer process type of dental surgery to ensure the bone is properly fused before the tooth can be attached. Implants require a procedure to create channels in the jawbone so that implants can be fitted with intimate contact with the bone. They generally require 2 to 6 months for the bone to fuse before they can have tooth restorations, a crown or bridge attached in order to complete the process. 3. Wisdom tooth extraction. Wisdom tooth extraction is the removal of adult teeth located in the back, bottom, and top corners of your mouth. These are the last third of molars to come in, usually between the ages of 17 and 25. When wisdom teeth don't have room to grow, they can become impacted and cause pain, oral infections, or other dental problems. Oftentimes, dentists will suggest wisdom tooth removal even if impacted teeth are not an issue, as a preventative measure. Wisdom tooth extraction is an outpatient procedure that takes a few days to fully recover. The procedure is done by removing the wisdom teeth through surgical incisions and stitching the extraction site closed to aid in the healing. It is important to follow your doctor's orders regarding the healing process to avoid excessive bleeding or blood clots. 4. Reconstructive. Accidents happen, and when there is damage to the face due to sports injuries, falls, worker-related incidents, or any kind of facial trauma, it can be scary and stressful. That's why seeing an oral surgeon is the best course of action. They can offer solutions that will have you looking your best in no time. A dental surgery for facial reconstruction breaks down into 2 categories of soft tissue injuries and fractures. Soft tissue injuries include trauma to the skin or gums, such as cuts on the inside of the cheek, lips, or tongue. Soft tissue injuries also include lacerations on the soft or hard palate. Fractures relate to the tiny bone tissue in your mouth and includes reconstruction to the jawbone and teeth. Larger reconstructive surgeries go into the nasal cavities and the forehead if the facial injuries are severe enough. In some cases, reconstructive surgery utilizes dental implants along with other methods of treatment and mechanics to repair jaw alignments and bone structure. 5. Cosmetic dental surgery comes in many different forms. Many times, cosmetic surgery is not a medically necessary procedure, but is used to improve the patient's face or smile. Cosmetic procedures covers minor treatments like teeth whitening and investments like orthodontics. Small makeovers combine 2 or more procedures such as teeth whitening, dental veneers, bonding, or composite restoration. Treatments to make teeth brighter isn't just teeth bleaching. Methods like bonding and veneers are also used to fix discoloration or stained teeth. Some patients even like having tooth shaping to fix the physical shape of their teeth. This is done by removing tooth enamel or filing the teeth. Cosmetic procedures are generally pain-free and can be completed in your dentist's office, eliminating the need for an oral surgeon. Of course, every treatment is individualized for the patient, regardless of whether you are looking for minor cosmetic dental surgery or a major dental procedure. Your dentist should be at the forefront of your medical journey. Many other health issues can be diagnosed and solved by keeping your oral health a top priority. If you experience any oral pain, tooth sensitivity, pain in the neck or jaw, or notice any discoloration or bleeding while brushing your teeth, contact your dentist today. A proactive approach to your oral health may prevent you from having any tooth loss or serious dental surgery. Oral health is essential for general health and quality of life. It is a state of being free from mouth and facial pain, oral and throat cancer, oral infections and sores, periodontal disease, tooth decay, tooth loss, and other diseases and disorders that limit an individual's capacity to bite, chew, smile, and speak of affect psychosocial well-being too. The objective of our study was to assess teeth cleaning techniques and oral hygiene practices among medical students. Methods. The data of the study were collected into stages. The first stage involved the administration of a self-constructed questionnaire among medical students. In the second step, the students were asked to demonstrate their teeth cleaning techniques on a model. Standard teeth cleaning checklist was used to evaluate the students. The students were then given the checklist and a video on teeth cleaning techniques was shown to them. The data obtained was analyzed on a statistical package for the social sciences ASPESA version 21. Results. Out of a total of 444 students, 256 at 57.7% were males, while 188 or 42.3% were females. About 250 for a 57% of participants were preclinical medical students, while 190 or 42.8% were clinical year medical students. A majority of medical students used medium consistency toothbrushes, 177 to 39.9%, and soft consistency toothbrushes, 137 to 30.9%. Most medical students at 140. Conclusion. Medical students were found to have a faulty teeth cleaning technique. There is a dire need to spread awareness about correct teeth cleaning techniques because poor oral hygiene can have a detrimental effect on the overall health and quality of life of an individual. Keywords: oral hygiene practices, primary health, oral health, medical student, gender, healthy lifestyle habits. Introduction. Oral health is an essential component of a person's health. According to World Health Organization WHO, about 60% to 90% of children and nearly every adult in the world have dental cavities. 1. According to American Dental Association (NIDO), oral health is a functional, structural, aesthetic, physiologic, and psychosocial state of well-being and is essential to an individual's general health and quality of life too. Poor oral health is related to significant morbidity and mortality. 3. According to a study done in the USA, it was concluded that the frequency of emergency department visits because of preventable dental conditions has increased by 16% since 2006. 4. Poor oral hygiene has a significant impact on general health and is associated with various systemic diseases. 5. The systemic diseases also have an impact on oral diseases. According to a review article, poor glycemic control is associated with an increased risk of severe periodontitis. 6. A study done on 18 students concluded that teenagers were considering the fact that medical students are more knowledgeable and aware of health problems. We hypothesized that medical students would be able to maintain appropriate dental hygiene. It is important to assess their oral health knowledge, attitude, and practice because they are future professionals who will be responsible for managing and preventing oral health diseases. The objectives of our study were to assess the teeth cleaning techniques and oral hygiene practices among medical students. Go to materials and methods. We performed an analytical cross-sectional study among medical students studying at Shifa College of Medicine, a private medical education institution in Pakistan, from June 2016 to December 2016. A self-constructed questionnaire consisting of 28 items was used to assess the teeth cleaning technique and oral hygiene practices among medical students. All medical students studying in Shifa College of Medicine during this time period were eligible to participate in this study. The students were divided into two groups. The preclinical group consisted of students studying in the first, second. Informed consent was taken from all participants, and the identity of the respondents was kept anonymous. The data of the study were collected into stages. The first stage involved the administration of a self-constructed questionnaire among medical students. In the second step, students were asked to demonstrate teeth cleaning techniques on a model. A standard teeth cleaning checklist was used to evaluate the students. The students were then given the checklist, and a video on teeth cleaning techniques was shown to them. The data obtained was analyzed on a statistical package for the social sciences SPECIA version 21. An independent t-test was done to see if there was any statistically significant association of p0.5 of gender and year of medical education with the score on the teeth cleaning demonstration and the mean number of soft drinks consumed. A Spearman's correlation was run to determine the association of the duration of teeth brushing of the participants with the score on the teeth cleaning demonstration. A p-value less than 0.5 was considered significant. The Mann-Whitney test was applied to determine the association of prior knowledge of teeth Table 1. Association of gender with oral hygiene practices and teeth cleaning techniques. Factors: gender, mean SDF, p-value. Score on the teeth cleaning demonstration: males 0.590, 0.997, 28.440 to 0.1. Females 0.963, 1.225. Mean number of soft drinks consumed in a week's time: males 6.824, 0.850 to 14.670 to 0.1. Female 3.712, 3.156. Open in a separate window. An independent t-test was done to see if there was the statistically significant association of p0.5 between the year of medical education, the score on the teeth cleaning demonstration, and the mean number of soft drinks consumed in a week's time. Medical students in the clinical year were found to have a greater score on the teeth cleaning demonstration than preclinical year students of p0.24. This has been shown in Table 22. Table 2. Association of year of medical education with oral hygiene practices and teeth cleaning techniques. Factors: year of medical education, mean SDF, p-value. Score on the teeth cleaning demonstration: preclinical 0.651, 0.40, 10.997, 0.24. Clinical 0.891, 0.192. Mean number of soft drinks consumed in a week's time: preclinical 5.661 for 0.167, 0.157, 0.401. Clinical 5.300 for 0.881. Open in a separate window. A Spearman's correlation was run to determine the association of the duration of teeth brushing of the participant with the score on the teeth cleaning demonstration. No statistically significant correlation was found, or is 0.93, p 0.50. The Mann-Whitney test was applied to determine the association of prior knowledge about teeth cleaning guidelines with the score on the teeth cleaning demonstration. Participants with prior knowledge of teeth clean guidelines scored statistically significantly higher than the participant group who had no prior knowledge of teeth cleaning guidelines. U20309, p0.1. Go to discussion. Numerous studies have been carried out to investigate gender-based differences in oral health. The prevalence of caries has been higher in women than in men, and the finding has been documented across various cultures and time periods. 8. Many factors can be attributed to this disparity, including lifestyle variations and cultural norms. 9. However, according to a study done on Greek dental students who were exposed to a literate urban environment and had better knowledge of health care, females were more likely than their male counterparts to maintain oral hygiene. This could be explained by the fact that women are more conscious of their appearance and body. Our study also found a statistically significant difference in the score on the teeth cleaning demonstration as the years of medical education increased. Students in their senior clinical years had a higher score than students attending preclinical classes. Greater health awareness and increased exposure to the clinical side of medicine could account for the higher score in students in their clinical years. However, the senior medical students did consume less soft drinks than their junior counterparts. The difference in the number of beverages consumed was not statistically significant, because students in their clinical clerkships educate and counsel their patients on various go-to conclusions. Medical students were found to have a faulty teeth cleaning technique. There is a dire need to spread awareness about correct teeth cleaning techniques because poor oral hygiene can have a detrimental effect on the overall health and quality of life of an individual. Go-to notes. The content published in Curis is the result of clinical experience and/or research by independent individuals or organizations. Curis is not responsible for the scientific accuracy or reliability of data or conclusions published herein. All content published within Curis is intended only for educational, research, and reference purposes. Additionally, articles published within Curis should not be deemed a suitable substitute for the advice of a qualified healthcare professional. Do not disregard or avoid professional medical advice due to content published within Curis.